For our study, we decided to look at the use of continuous passive motion on TKA patients and the effect of patient overall success. Our clinical practice issue pertains to the use of CPM machines on postoperative total knee arthroplasty patients. Our aim was to determine the effects of these machines on the patient's overall success in comparison to the use of conventional therapy. With regards to current clinical practice, Mercy Claremont Hospital requires 2 hours of continuous passive motion 3 times a day for patients recovering from TKA. The clinical practice can be extremely important to all aspects of the healthcare field, from patients to nurses to the overall quality of the healthcare. Patients undergoing TKA will benefit from finding the best practice for their care, along with shortening their length of stay in hospitals. Nurses will be able to adapt and understand what clinical practice is the best for TKA to ensure the best care is given. The overall quality of healthcare can improve with shorter hospital stays, cost efficiency, and overall success of patients. In postoperative knee replacement patients, what effect, if any, does the use of CPMs in comparison to conventional therapy have on the patient's overall success? For our PICO question, our population included total knee arthroplasty patients, both single and bilateral. Our intervention was the use of CPMs. Our comparison was that to conventional therapy, which included conventional physical therapy per hospital or clinical protocol, and our outcome is we evaluated our patient's overall success. We further defined overall success in the categories of range of motion, pain, wound healing, swelling, and quality of life. Our research databases included 2, CINAHL and HealthSource Nursing Academic Edition. The keywords used included knee replacement rehabilitation, continuous passive motion machines, recovery time, range of motion, and pain. For the limits on the search, we included articles between the years of 2010 2015, English language, peer-reviewed, and academic journals. Our first article was a research randomized control trial that was both quantitative and qualitative. It included 84 patients split into no CPM, 1-day CPM, and 3-day CPM groups. The study concluded no statistically significant difference among the 3 groups. Our second article was a research randomized control trial that was both quantitative and qualitative. It included 141 patients split into 2 groups of conventional therapy and CPM use for 2 hours a day. The study found that CPM does not provide an additional benefit over the conventional therapies. Our third article was a research quasi-experimental and quantitative study. It included 107 patients that were split into groups of CPM use and active exercise alone. The study concluded that aggressive CPM during hospitalization provides no additional benefits. After review and synthesis of our research data, we concluded to have high-quality, level 1 data with good and consistent evidence. Our findings state CPM use has no additional effect on patient overall success in terms of long-term care. In comparison to conventional therapy, there is no increased effects when using CPM. Our evidence supports the cessation of CPM machines in healthcare practice, which contradicts the current practice of Mercy Claremont Hospital. From this information, our recommendation are stopping the use of CPMs. Enough data shows to support that conventional therapy is just as effective as CPM use.
The conventional therapy we recommended was the drop and dangle approach following total knee replacement. This is intended to improve knee joint range of motion, decrease swelling, improve circulation, and assist with pain control while replacing CPM usage and maximizing patient safety. Patients are to work with physical therapists 2 times a day, participating in PT treatment/plan of care. Treatment will incorporate sitting in the chair and the use of a maxi slide sheet under the surgical foot on the floor, sliding back and forth to 90 degrees or greater as tolerated. The second exercise recommended is in the bed with the head of the bed elevated and lower mattress locked into full extension. A maxi slide sheet is positioned under the leg, flat sheet looped around surgical foot and ends placed in the patient's hand. The patients are instructed to use slide sheet to pull knee into maximal knee flexion for at least 30 minutes in the evening. The goal of the drop and dangle protocol is to reach at least 90 degrees of knee flexion prior to discharge from the hospital, while eliminating need for CPM use.
By implementing these exercises into therapy in place of CPM machines, patients will limit time spent lying in bed. There will be more patient-centered therapy promoting physical improvement. Less money will be spent on CPMs, leading to more cost-efficient care. There will also be shorter hospital stays.